Hello, my name is Caitlyn, and I'll be your host for another episode of your Health, Wealth, Happiness, and Spirit. Today, we will be covering the topic of COVID variants. There's a lot of information out there about certain variants of the virus, and Dr. Sadiq is here to help us better understand what's going on. Welcome back, Doctor.
Thank you for having me.
Now, we have a lot of ground to cover here, so let's just jump right into it. Starting with the basics, can you explain how viral variants emerge?
Viruses are constantly changing. Most of the mutations don't matter, but occasionally a virus can mutate in such a way that it actually that becomes more stronger. So it actually spread easily, and also it can infect our immune system in a more dangerous way.
So usually the mutations don't matter, but sometimes they can make the virus more effective.
Absolutely.
Now, COVID already has several variants that have emerged. Is that correct?
Correct. The CDC has identified several variants of concerns of COVID-19 virus.
And what is a variant of concern?
Like I said, most of the changes in the viruses don't matter. But each time the variant of concern comes in the picture, the mutation of the spike protein, we call it, which makes them more infectious and I can say even more stronger.
Now, can you elaborate on what a spike protein is?
Sure. The spike protein is a part of virus that acts like the key and that let it break in and infect our cell or our body.
So these are considered variants of concern because they're more effective at breaking into the cells.
That is exactly right.
Now, what are the variants of concern listed by the CDC?
There are currently 4 variants of concerns: alpha, beta, gamma, and delta.
Now, we have all heard a lot about the Delta variant, but can you elaborate on why it's the most concerning of the variants?
Delta variant is more than twice as contagious compared to the other 3.
When you think about how contagious the initial strand was, that really puts the Delta variant into perspective. Now, is there anything else about the Delta variant that sets it apart from the others?
Yes, the data suggests that Delta variant can cause more severe illnesses in unvaccinated people compared to the previous variants. This leads to the other problems like increased hospitalizations.
You mentioned before that this specifically impacts unvaccinated people to a greater degree. So is the vaccine still effective even with the variants?
Yes, the vaccination can still go a long way in preventing hospitalization and infection, even from the variant of concerns. Vaccinated people are not only at a lower risk for infection, but they are much better able to fight the disease.
So it's important to continue working towards herd immunity, even with the variants having emerged in the US.
Yes, it is very important to vaccinate if you are getting clearance from your doctor. So vaccination is on the top of preventing this disease or getting rid of this disease. So I'm going to really stress a lot on vaccination because this is the only way we can actually save ourselves and save others, because there is this disease is really a deadly disease.
Interesting. So as long as your doctor agrees, the best thing you can do to address the spread of COVID and its variants is to be vaccinated.
Absolutely. Getting vaccination is critical to stop the spread of the COVID and its variant.
Is there anything else you would recommend our viewers do to stay safe?
Depending on where you live, the CDC will have different guidelines, but in the areas of high transmission, it is important to wear a mask. Even in the indoors or outdoors, you can save yourself and others.
Do you think people should wear a mask even if they're vaccinated?
I would recommend following the CDC guidelines on this is very, very important, but use your judgment. If you are in an area where you feel like the people are not vaccinated and the transmission is high, so I would suggest that wear mask, and that way you will prevent the spread or you will not get the disease. But you can also use your judgment. If you are in the area where mostly people are vaccinated and transmission is low, you can skip the mask.
That makes sense, Doctor. Do you have any other advice for our audience regarding the new variants of COVID?
Hearing about different variants can be concerning, but the vaccines still work in preventing the spread. Help you fight the disease. If you are medically able, vaccine will help keep you and those around you safe.
What great advice. And for those interested, in the description below, we will have links to CDC guidelines and vaccination information. Thank you for taking the time to talk with us, Doctor.
I'm glad I could help.
And that's all for today's episode of Your Health, Wealth, Happiness, and Spirit. Until next time, stay happy, healthy, and live better.